The need for government at all levels, communities, civil society organizations, among others, to synergize to strengthen the Anambra State primary health care system has been stressed. This was the summation of speakers at a press briefing organized by AIDS, Tuberculosis and Malaria Network led by civil societies on malaria control, immunization and nutrition, and the Anambra State Ministry of Health, held in Oka. Health correspondent Chibuzo Okoye again has details.
Speaking during the press briefing, the Anambra State Program Officer, Civil Society for Malaria Control, Immunization and Nutrition, Mr. Wisdom Jacob, said that the aim of the organization is to strengthen the primary healthcare system, which is the closest to the people in rural areas through community engagements. Mr. Jacob noted that the program, which has lasted about 1 month in Anambra, goes into the various communities, assess their primary healthcare centers, interview community members on how they receive medical services, identify gaps and challenges, use the information gathered to profile solutions by engaging both the government and community members in order to strengthen the healthcare system.
So while we do this project, we are trying to build up those gaps identified so that accessing healthcare center can be very flexible and simple. And also, we are not just allowing the healthcare center to be the work of the government. We are now trying to mobilize the community and individuals within the community to see how we can build our healthcare centers to make it sustainable for our own use. So that's the essence of the project.
The Anambra State Coordinator of Civil Societies for Malaria Control, Immunization and Nutrition, Ms. Chioma Okeke, represented by Mr. John Ibekwe, said that the gap identified during the monitoring of primary healthcare centers will be noted and prioritized, which will lead to more effective service delivery, improved accessibility, affordability, and investments by communities and governments at local and state levels for healthcare services.
Similarly, routine malaria diagnosis and treatment access was disrupted. The implementation of the malaria indicator survey and the tuberculosis or malaria could be minimized by maintaining these core services.
For the Anambra State Technical Specialist, Resilient Sustainable System for Health, Ms. Chizoba Mbanefo, representing the State Coordinator, urged the Anambra to embrace members of the various groups each time they visit their communities in order to enhance the health indices of Anambra State, as enshrined by Governor Chuma Soludo's administration.
We want the whole of Anambra State to know that there is a group that is going out there seeking for help for the communities. And we want to ask them that in the sense that when they come to you, Anambra is our home and there is nothing we cannot benefit from it.
In their various species, the Anambra State Coordinator, Tuberculosis Network, Mrs. Ifeyiwa Onachukwu, as well as the State Coordinator, Network of People Living with HIV/AIDS, Mrs. Gladys Ezembo, urged the Anambra to take ownership of the project towards improving the state's healthcare system, and equally urged the mass media to help them enlighten the citizenry about the activities of the group, which is currently ongoing in the state. The pilot stage of the project in Anambra kicked off with Anambra East, Oka South, Agwata, Dunukofia, and Nnewi South local government areas. In Oka, this is Chibuzo Okoye for ABS News.